start. Kia ora koutou, ko Kim Taylor toko ingoa, ke the loft aho e mahi ana, ko o te kaiarahi. Greetings to you all. I'm Kim Taylor. I'm the team lead of the Social Emergency Response Service at the Loft. And I just want to thank all of you for being here today and thank Claire for being such a good host for this.
Kia ora, thank you, Kim. Kia ora koutou katoa, whonai Pakihami Ngāti Tau Iwi Aka Iwi, no Manchester aho, kia o te tahi aho, e noho ana anaine, ko Kēra Grady toka inua, hei kai mahi ono the Loft ko o te kai whakahaere. I'm Kēra Grady and I am the General Manager here at the Loft working alongside Kim.
Yes.
And I can talk a little bit about how the sort of session will go today. So I'm just going to talk a little bit about the Loft in general and what the Loft is, what that embodies, some of the things that make it a little bit different and a bit unique, and then Kim's going to unpack a bit more about that specific crisis response service that we do. So I will just get our slides ready and we will go from there.
Is that good? You can see our slideshow is cool.
Okay,
go for it. Okay, I'll click.
Okay, thanks. Perfect. So welcome to the Loft. So we are, as Claire was saying, we are based in Eastgate Mall, and we are on the eastern suburbs of Otatahi over in Linwood, which is a well-known lower socio-demographic area within Christchurch and very purposely based here, and I'll talk about that a little bit. The Loft is very much bringing together social services alongside the crisis service. So we are about co-locating, but doing that next level of co-location for social services. So we want to support active collaboration for our partners. So when people come into the Loft, they get all these additional benefits with very little sort of input into output, I guess, into getting all these benefits. So at the moment we have 15 partners. We'll show you who those are in a little while, but all these people come to the Loft, they sign up to agree to do more for our community than just their own mahi. And it's about finding those benefits of being alongside these agencies. There is all these ways of sharing resources, donations, all this shared knowledge. When you have a room full of all these professionals across all these different agencies working together, that only benefits each other and allows us all these ways to learn more and do more for the people that we are working with and serving. Some of the ways we do that collaboratively, we have several work groups that are done across our partners that engage people to either support learning opportunities. We'll do a lot of shared trainings, different workshops. We'll also run lots of collective events together. So it could be community events or even just internal events to help some of that networking, the connections between people that then mean that, you know, if you have a question about something that you're unsure of, instead of having to Google agencies, look them up, try and find who's still open, what they're doing, you know that person and they're across the room. So it's very much those benefits of having everything so accessible and so easy. And that's always the focus of every part of the Loft, is to reduce those barriers and make everything as simple as possible for kaimahi, but also the whaiora who are accessing all the services here. Thanks, Kim. And this is just our whakatoki. So this was gifted to us by Ngāi Tahu during our development process. And it covers the depth of what we're trying to do here, that we want to support people to go from surviving to thriving. And it's that change of just people struggling and existing, not knowing where to go, not knowing where to turn, having one space that people can come that can actually change that whole dynamic for them and really the trajectory of situations for themselves. So our location. So this is really key and such a core part of what makes the Loft so special is majorly the fact that we are based in a mall and that we are based in the suburbs that there is significant need. And so like I've said about barriers, all these decisions to base here have been around making that easy for people to come to. It's really accessible. People are coming here anyway. There's a real community feel in a mall. While it's unusual for a social service to be based here, we find significant benefits from that. particularly for us, so we are upstairs in a mall, we're on the first floor. So it's very private, it's very confidential. A lot of people won't see you coming to access the loft. And even if they did, we have so many services based here, nobody needs to know which service you're coming to see. And we're also based alongside a medical centre and a library. So people coming upstairs could be coming to use those services, so that it takes away some of that fear some people may have about coming to access service. Safety-wise, hugely important for us that for a lot of people, it's not safe to access some service. People may be having their movements monitored, and people may struggle to get away to come to appointments. So being in a mall, people could be coming to do their shopping. Again, nobody needs to know that they're actually coming up to access that service. If somebody was in a situation they were being tracked and it showed they were at the loft, one of our partners is Plunkett. They might be having a Plunkett appointment. We have community law here. We have so many services here and the medical centre next door that actually it allows people that safety to be able to access service without having to sort of disclose where they're going and who they're going to see. Coming into our front door, we've got all, you may be able to see on the picture, all the partners who are here on that front door. So even that moment of coming into somewhere, you're not walking into a door that says, this is this service that I need, whatever that may be. You're walking into the loft and you don't have to sort of disclose that even by walking in. So it really makes it about that manaakitanga of coming in, making it simple for people, making it welcoming for people, and making it really easy to come and access support. Okay, and just partners wise, so we have a mix of partners, and part of what we want to do is offer real flexibility to how we work with other social service providers. So we have this collection of people who are all based on site with us permanently. Others may only come once a week. We may have people come twice a week to do dedicated clinics.
That's the next slide.
And that's the next slide.
Yeah.
These would be the dedicated clinics. Very much what you'll see around those people who are here is everybody brings their own speciality. We're very big on not duplicating service, so we don't have multiple partners on site doing the same mahi. Everybody comes with that specific something that adds to the loft. So whenever we're bringing in a new partner or we're talking about bringing people in, we're looking for people who add something extra, and that comes with them. It means we can be really flexible, and it's really helpful that, you know, for things at the moment, sort of sector-wide, things like housing have become a much more prevalent issue for our community. It means that we can look to specifically engage partners that may be of that use or working in that area. Sort of a couple of years ago, we added a tenant advocacy service. And that's the sort of benefit that we have, is that we can be really fluid around what those community needs are showing and make sure that we have the most appropriate services available here for everybody.
Cool.
Does that cover it?
That does.
That
yeah.
covers it. I will pass over to Kim. So she will talk a little bit more about, attached to what the loft is, we also have this special service.
Let me just, can I look at your phone just for time? Because I'm afraid I'm going
Sure.
to, I can't
It's
see.
12:20.
Okay, I will try to keep it within that time, because I could just go on and on about the loft. So our mahi, we run a social emergency response service, our SARES. You might think of it as a crisis service as well. But many of our whaiora, our clients, are not in crisis when they come in. They're trying to prevent being in crisis, and that's what we're all about as well. So, or it could be someone has a lot going on and doesn't know where to begin. That's kind of where we shine. So Kate has spoken about the loft as this collaboration. I'm the team lead of the SARES, and this is what the loft, the unique service that we bring. One of the earlier slides had noted, we bring that manaakitanga. So the team is me and two connectors, though right now it's a very small team of me and one other connector. Hopefully have another connector soon. And then we have our Tatafi Manuhiri, our receptionist, and our office manager, who sit out front as well. And their role is so important in greeting our guests, offering warm cup of tea, coffee, glass of water. They do so much of making people feel welcome and calm when they first walk in those front doors. So how does our service work? Clients or folks referring, contact us by phone, email. We have a web inquiry or just drop in. So our social emergency response service is open 9 to 4, but we close at 5 regularly. Right now we are on reduced hours as we manage some staffing issues. But so to get a good assessment in, we do ask that people would come in by 4. Let's just imagine we're at normal hours. But if somebody came in crisis at 4:45, we wouldn't shut the door on them. We would find a way to support them. But we're not a 24/7 service. And then what happens is the community connector completes a well-being needs assessment, which I'll talk a little bit about later, and then co-create with a real focus on the co-creation, which is part of our framework that I'll talk about. We develop a plan with the FIOTA. So there will be some things that the connector does, but also things that the FIOTA will do. And sometimes it's merely an information session, and we don't have to action anything, but letting people know what's available. So the kaituhono, the connector will try, emphasis on try to meet crisis needs. So that might be, if you think of Maslow's hierarchy of needs, food, clothing. We don't provide shelter, but we might do some advocacy in that space. And I could talk a bit about that. So what can we do? We're not a food bank, but we keep food on site. We keep clothing, toiletries, sanitary products. Often I go to Kate asking what is in our coffers in terms of maybe most recently, I bought a mobile phone and a SIM card because we didn't want to wait to see if work and income was able to step in. We have unfortunately been in the situation of buying a tent for somebody who was sleeping rough and had their items stolen. But that's not always available. It really is, what can we do in that space? And then the collaboration is, how can we work with Loft agencies? What can happen in this space? It might be a great recent example, Enabling Good Lives is based here. So we, in that case, we actually could refer to them, but we had a client with a disability and they're so knowledgeable. Can we bring them into the space? And then connection. So where longer term does the FIOTA need to go out in the broader Otatahi area to get ongoing support? And I'll talk a bit about what brief intervention means. So we are kind of always there for people to reconnect, but the fact that we never close to referrals, and although we ask our FIOTA, give us at least 2 days to get back to you to set up appointments, the truth is we get to people same day, and we will see people immediately if they're in crisis. But if not, we will book them in. We have a system to book people in as soon as possible. So that kind of is the 3 C's: the crisis, the collaboration, and the connection. And later on, I'll walk you through a couple scenarios about what that looks like. In terms of our clinical frameworks, we kind of pull from 3, and I'll break it down a bit more. So psychological first aid, the 6-step crisis intervention model, and what underpins that is our well-being needs assessment that brings in elements of te whare tapawha. So within these, or under these frameworks, the connectors are trained to support clients across a broad spectrum of need. This could be really basic tasks, which are I really like those because they're so concrete at the end and you see what's been accomplished. Helping someone fill out a work and income document, helping someone draft a letter to the Ministry of Education. It could really be anything, to more complex interventions. So that could be someone is suicidal or someone has just been assaulted and they've come to the Loft because it's known in the community, creating safety plans, but most especially hooking them in with what I call the 24/7 services, where they really need to have eyes on their situation beyond the Loft, but also the Loft being that place that they can check in again. Let me just take a little. So I won't read this off to you, but our clinical frameworks are really about a comfortable place for our whaiora to tell their stories. And that really is what our well-being assessment is. We go through the usual confidentiality statements and gathering key details, but then you tell us your story. And it can vary so much from person to person. Of course, we need to make sure that our whaiora are safe and that their basic needs are being met as much as we are capable of doing that, and then developing that plan to support them. And that's kind of what these frameworks bring in. Sometimes clients come in, maybe they want budgeting advice, but when you sit down and you listen to what they've been managing, realizing that there's a lot more going on. They need budgeting advice because there is family violence happening, possibly AOD issues. So that conversation, you know, we really are generalists. We're like social service generalists. And it might be, we go support one client and it's high risk family violence. We have to know how to navigate that within these frameworks. But then the next client we see, possibly they're managing homelessness. So we have to know how to navigate within these frameworks for that. So part of the role of the connector is doing just that, connecting with services throughout Christchurch. We really do try to bring the mahi-tahi of the Loft to the wider community. And there are a lot of organizations who work that same way, which is wonderful to see. And then what underpins the frameworks is Te Whare Tapawha, our well-being needs assessment. So while these are optional questions, we do give our whaiora space to talk about any mental, physical, spiritual health concerns that they have. And those are really interesting conversations because maybe they didn't come in for any of those issues, but when you ask the question as an option, most people do share that. So if they were to share, oh, I'm anxious and depressed, but I haven't seen my GP in a year or so, we can then say, oh, well, that's not why you came in, but do you need to see your GP? What can we do to facilitate that? A space that taha whānau, a space to assess past and current support networks. Who is, it could be really interesting conversations where someone is not feeling well supported, but when you see who is actually on the scene, like there's actually a lot of supports in place. Maybe why aren't they engaging? Have there been missed phone calls? And do we need to make those connections again? So again, that is an optional question, but we learned so much from it. And then whenua. So that is connecting to culturally appropriate services. We are, you know, we're not a Kaupapa Māori organization. We're not a Pacifica organization, but part of being part of this team is to understand what services are available in those areas. Like one of our partners is Asian Family Services. We can talk to them. How can we provide culturally appropriate support in terms of making those connections? Just to give you a snapshot of what this looked like in 2024. So at that time would have been amongst 3 connectors really. So me as team lead and 2 full-time connectors. We completed 768 assessments. So in terms of what brief intervention means, 91.5% of our clients, we completed engagement in 2 weeks. So what that means is we met those crisis needs and we either they didn't need anything after a first assessment, or we made those relevant ongoing connections in all of our engagements, and very deliberately. If it's safe to do and a comfortable thing to do, I'd say probably in over 90%, the client knows that we are closing, which can sometimes feel a bit, people don't like to hear that, but another thing about our services, people are always welcome to come back. If it's for, you know, as long as they, you know, are giving the other services a chance. So when we close, it can always be reopened. So the client will know this is what's been done, this is what's coming. We're going to step away now, but you're always welcome to come back. The loft is also a check-in place where people can say, hey, I haven't heard from that amazing service, because maybe there's a long wait list. And we can, if the client doesn't feel comfortable, we could be the person giving that little nudge to see where things stand. So this is just a snapshot of the main reasons people will come in to the loft or did come in. So those are the main primary reasons, the pie chart. But the most common reason, which I think is so telling, is 40% of our clients have that shared issue of managing mental health concerns. I've been with the loft since 2019, and I've really seen such a shift. So family violence was historically the main reason, I'd say by a large margin, the main reason people came in. Since about 2023, housing and mental health have really increased. So again, while mental health isn't the main reason, it's always there, which makes sense if you're managing these issues. But housing has become just a massive thing that our whaiora are trying to navigate, from homelessness to having, not feeling safe in their home, things like that. And again, we would set up ways to manage all of that. Again, just informational and brief in terms of age range, ethnicity, and gender. We are, there's really nothing that would bar anyone from accessing our service. Even clients, if there was ever an issue around safety and having them in the loft, we would just do phone assessments. But yeah, there's really nothing to prevent anyone from accessing support at the loft. So now I'll just quickly share a couple scenarios with you about what this looks like. I could probably spend hours with scenarios because they're all different. So, and these are pseudonyms, of course. Hone is struggling with cost of living and may lose his tenancy. He sometimes has thoughts of suicide, but is okay today. So what might we do? So remember the crisis, collaboration, connection. Create a mental health safety plan, arrange an immediate appointment with Hone's GP, and then arrange a time to see or talk to him again soon. That's part of our mental health, our suicide response, is have them have something to look forward to. Collaboration, refer to our clinic, Kingdom Resources, for budgeting support. Link people, a community housing provider who's based here has a sustaining tenancies contract. So get them queued in with Luke at sustaining tenancies. And then outside the loft, so that's the connection. Food parcel delivery, just to make that cost of living a little bit easier to navigate. And then a referral to a community support worker. We make a lot of those, but it's such a popular, amazing service that there is a long wait. So we would also let Hone know that the loft is a place that he can come in and reconnect in between. Another common scenario, both of these I could say I've managed within the last even 2 weeks. Mary is with her daughter. They left home quickly after her husband assaulted her. He's taken her phone. Crisis space. Provide a phone and SIM, necessities, clothing, toiletries, work and income advocacy for a security bracelet and financial assistance. We could go, work and income is right across the road. We can go over and talk to work and income. Collaboration, referral to community law, our Ministry of Justice, Kaiarahi, Family Court Navigators for urgent protection and parenting orders. And then connection, support on a call to Women's Refuge for safe housing. And again, these are just two of various ways an assessment can go, because not everyone needs safe housing, so it would always look different. So that gives you a snapshot of what we do, and I'm going to give the final slide to Kate about what is our impact, because it can be hard to track what we're actually doing.
Yeah, so this is the results. This is from our Impact Lab assessment. So we did this a couple of years ago now, and really wanted to know, particularly with this crisis service, while we've always had good feedback and positive reinforcement from who we're working with, really wanted to ensure what we're doing had a positive impact on those we're working with. So we've got a social return on investment of just under $4 for every dollar, which for a brief intervention service is incredibly high. You have to take into account that generally we may only see people one time, but that one interaction that we have with people can make such a significant change in the trajectory of where their life may have gone or what issues may have come. We're hoping probably to redo it again. This is now a couple of years old, and we're also looking at potentially doing one about the wider collective and the positives about having all the agencies here, because this is only based on our service, not also the wider Loft and how that benefits. So we're hoping to do that in the next sort of year.
Thank you. And I think that brings us to the end. So I'll stop sharing now, but happy to answer any questions. We could just decide as we go.
There's some stuff in chat.
So Kim, we do have one question in there about how do you calculate the social value, which is a good question to answer.
That's why I had Kate say that, because it's the external company who does that, which.
So we did that through Impact Lab. So they reviewed a lot of our data, feedback, our referrals, like a year's worth of data of various things of seeing where we were placing people, and from that they could very cleverly work out how that return on investment was done.
And what they showed us is, because I'll be honest, I don't fully understand it. That's why we need people who can do that kind of work. What they looked at is, where would the person go if those needs weren't met? How, if the crisis isn't met at this point and they need to kind of escalate at how that just winds up costing. I don't like putting it this way, but that's how it's looked at. Then more money has to go into supporting that one individual or that one whānau. But if you're able to manage it early on, it doesn't get to that higher crisis need where more resources go into it. That's kind of how I recall them explaining it to us.
Definitely our interaction can just make that point where it can really get people just aligned with where they need to be rather than it escalating.
And I'm just going to share the last screen because someone,
I think, for the
that?
contact details.
Yeah. I could even, maybe I could copy and paste them. I think what I copy and paste it into the chat.
But yeah, also happy if people after the session have questions or want to get in touch. Absolutely do.
Yeah.
We're always open to.
It looks weird, but it does look
weird. It's worked. It's worked. She'll be right. The screen on social.
Oh, okay.
We can do that.
Yeah.
But if people do have any questions about sort of the setup or how it works, or even people who are looking for potential spaces east side of Christchurch, we are always open to meeting new partners and connecting with people. So please do get in touch if you think it would be useful, or even I know we've got some national people here. If you're looking at services or expanding down to Christchurch and want to investigate how that looks, really happy to Kōrero that as well. So do get in touch if you would like to.
Yeah. I'll just leave that up for a couple minutes if somebody would want to whoever wanted that, you're welcome to take a picture of it.
Absolutely. Right. Well, I think that's everything from us.
Kate and Kim, can you see the other question from Olivia? The funding model, how does this work? Your funding model.
Yeah, that's a
me.
That's an ongoing issue and a Kate, please,
So for the Loft, we have different income streams, part of which we are a social enterprise. So we hold the head lease of this space and we hold all the associated risks and everything with that space, and we sublease, and we also hire out. We've got lots of meeting rooms, training room things. So we do use our space as a way to bring in income, which is great. And we're very lucky that we have got a beautiful space here that we can do that with. And we have several different grant supporters who we're very grateful for their support. And we have previously had some government funding that was through COVID. And we are in a position where we are looking at ways to replace that government funding for the Loft. And as a model, it is almost difficult to fund because we're almost this generalist service, and so much funding is for specific areas, whether it's older person, young people. And because we are so generalist in what we do, that makes it really difficult to fund. And also being the holder of a collaboration isn't really something that funders have quite worked out how to fund either. So we have over the years done various different things to work out funding. We were partners in a vaccine centre during COVID. Like, we've done lots of different things to keep the loft growing and being established and being part of the community. But we're definitely working on that long-term sustainable plan, which is something we are working on at the moment to make sure that the loft as a model can then be replicated. So if people want them in Wellington or anywhere else, it's got a real easy funding path that, while it's been a struggle for us to work out over these years, it won't then be for others, and they could pick that up and use that. And so that's the sort of final piece we're working on at the moment.
Yeah, it's almost like the uniqueness of the service sort of works. I don't want to say works against us, because I know we're going to get amazing funding, but it does in a sense. Yeah,
it is. It's been that gap filler. So while we've got all these partners who do all this amazing work, those specific works can be funded under different things. You kind of need this generic funding that fills everything else in between, and that kind of cement between the bricks. So that's what we're trying to get sorted at the moment. Perfect.
Do we have any other pathway from any of our attendees? Kate or Kim? Some really interesting as we're kind of moving into more of a social investment landscape, I think, to get some of that data that you've just shared. So thank you for that. And that you were, that happened a number of years ago, so relatively recently, but also early in terms of what we're moving into now.
And feel it is that space, that it is that sort of social investment model that could be replicated and utilised. And I like to envisage, you know, a loft in every mall, and how could that look for people, and how much easier could services be for people to access. So one day.
I did see a question about right service, right time. Thank you, Libby. I think it's similar. Right service, right time, as far as what I know, because we have worked with them before. They are focused on children and youth support. So I think just the kind of the ethos of it is very similar. At least the one in Christchurch doesn't have a drop-in service, but we ourselves have referred to them before. You know, being generalists, we can help people figure out, but I know with that program, it's, I guess the similarity is somebody has a concern, and there's so many supports available, and you don't know where to begin. So I'd say in that way, our mission is very similar.
Yeah.
And I just want to reiterate, Kate, I think, said, people are welcome to visit if you're in Otautahi or through the area. We would be happy to meet with folks and show you around.
A few more minutes if anything else comes up that people would either like to share with Kate and Kim or across the group, or any other questions you might have.
Just a thanks to Steve. I also think we are what the social investment agency is talking about. So yes, thank you.
We want to see that.
And it is very aligned with the social investment agency. They are very much looking at organisations that have this interaction before things escalate, and how we can do that in a real cost-effective, easy way. So yeah, we feel that too, Steve. We're hoping that's something that may be a good connection.
I just have a quick question, Kate and Kim. I apologise if you can hear the printer in the background here, but oh, good. I'm just wondering, in terms of you having a network, are there other co-located connection organisations like yourself across the motu that you're already aware of and connecting with?
There are definitely some other co-locations. So we would work locally, even with places like Phillipstown Hub or our community house.
Yeah, community house.
And over the years, I've definitely supported similar models that they're trying to set up in like Queenstown, Tauranga, Palmerston North. I think the real unique piece for us is this drop-in service that's alongside it. So I think many people see those benefits of that co-location, and I think that's a model that people really engage with. For us, it's adding that extra layer of enabling that into the service provision, and also that extra layer of collaborative support for all of the social service partners. So similar, but I think we're a little bit special, but don't tell everyone.
I'll have to check that one out. Here to help.
Yeah.
That's cool. Yeah.
And that's, I definitely think there are, similar kind of understanding that co-locating is that benefit and what that brings for everyone is, and that you can still celebrate, I think, your individual agencies and all of their amazing mahi and what they're doing, but being part of a collective just adds to that. It doesn't take from that.
Thank you so much, Kate and Kim, for your time, for that amazing walkthrough, what you do on an everyday basis. I love the term connector as well, because you certainly gave us a really good picture of how that connection is happening and for the greater good of the people that are working in those organisations and agencies, and of course for the whānau that they're working with. So that was wonderful. Thank you so much. That idea of a community hub may be quite inspiring for other people as well on this call today, and wider for people that get to watch this recording, because of the way times are for us at the moment, and that it may be that collaborative and co-located agency togetherness is one of those ways forward that we can still be doing our mahi and be doing it even stronger. So thank you so much for that. I also really loved how you were talking about the benefits and some challenges of being the generalist and also the specialist at the same time, and being able to kind of have that melting pot of both going on. Thank you to everybody that was here with us today. Again, giving your time and giving your input. It makes it much richer when we have these sessions, and I really appreciate you all being here together and interacting with us and with each other. I do just want to mention that we do have our next Kōrero coming up in August, on August the 12th. And for that session, we're actually looking at emergency preparedness for kaimahi and communities. And that's going to be with the National Emergency Management Agency. And we just had the pleasure of being able to go to the Parliament bunker recently and do a wee tour. Fascinating time down there. So we're looking forward to that in August, and please do let other people know, and we'll of course promote that closer to the time. So unless there is any other final thoughts, we will have a karakia to close us today. Just giving one more moment in case anyone has any thoughts to share. And that karakia will hopefully take us from the space we've been in together back into the rest of our day and whatever we need to move into. Okay. Karakia whakamutunga. Ia tau te rangi Māori e, o te rangi nui I ta iho nei, o papatua nuku I tā koto nei, o te tai ao e awhi nei, ki runga I a tātou, te hei, mauri ora. Thanks everyone. Thanks, Kōrero.
Thank you.
Day.
Look forward to seeing you all again soon somewhere. Go well.